Thank you all. Can you hear me well? Yes? I apologize for the rain. It's an attempt at sabotage, but it won't. It's absolutely wonderful to see you all here, so enthusiastically mobilized, so incredibly numerous. It's really, really crazy. It's true that alternative medicines are indeed the future of medicine. That's definitely my conviction now. So, I was asked to talk about two topics. Lyme disease, because I've been fighting for this disease for 20 years, which is still not recognized in its chronic form, or very little. And then, I will talk to you about the autopsy of the healthcare system. It seems defeatist to say that, but it's to revive it. I'm always optimistic. Don't worry. Lyme disease, you know, is transmitted by a bacterium called Borrelia, transmitted by ticks. Rest assured, here you are in the middle of the forest. You are surrounded by ticks. I don't really know how many survivors there will be, but we can definitely count all of them. I was surprised, as I've handled many infectious diseases, and this was the only disease in my career that was not allowed to exist. In its chronic form, we will understand why. It is a bacterium that is transmitted by ticks. It is a type of bacterium with many species. It has existed since the dawn of time. We found a frozen mummy, a poor guy who was killed by an arrow and fell into a glacier in the Alps approximately 5,000 years ago. He was indeed a carrier of Borrelia, so it's not actually new. What's new is after the procedures and manipulations we did later. Well, it might come one day, so the situation might change. Thank you. Is it working now? The bacterium, we call it spirochetes in Greek. Spiro means spiral. They are small spiral-shaped bacteria that can move very quickly like little snakes. It resembles Treponema pallidum, syphilis bacterium, or other bacteria, but it's a bacterium with phenomenal genetic capabilities. It can change shape. I believe it's the bacterium that can affect humans, which has the most functional genes. A functional gene in the chromosome is what allows it to adapt to all aggressions. It can change shape if attacked by an antibiotic, the immune system, the acidity of the environment. It's incredible, and it can sometimes take on a round, dormant form, like a submarine that turns off its engines. It can remain in your tissues for months, even years, and then wake up. It's a rather fascinating bacterium. It's extremely interesting and is transmitted by small blood-sucking ticks. Your doctor tells you that you might have Lyme disease. You were bitten by a tick. I don't remember before going around. There is nothing to see if you don't remember. In fact, studies show that 3 out of 4 times people have no memory of the tick bite, because there are large female ticks that are well engorged with blood, which you can see. You see them on your dog, your cat, but you can also see them on yourself or someone in your family. But there are mini ticks, the nymphs, the larvae, which are tiny, and then they are on your back, in your hair. You don't see them. It's really tiny. It's mostly in the forests, but don't think it's only in the forests. There are some in parks, even in certain cities and in gardens. It's true that they are more common when the grass is tall. Remember a tick bite in a quarter of the cases, and the erythema migrans, that famous circular red rash spreading outwards from the bite. Your doctor will ask you, did you have a red spot? Oh, well, no, I don't remember. Oh, well, it moved around. You don't have the donkey. We only remember it in half of the cases. All of this is based on papers. It's not something I'm making up. And in addition, the erythema migrans, the typical form is a red bullseye that gradually expands like this and sometimes disappears spontaneously. After a few days, a few weeks, even if we don't treat it, the bacterium remains there and can progress to the secondary, tertiary forms of the disease. Normally it's painless. It doesn't itch. Sometimes it itches. Sometimes it's a bit painful. Normally it's red. Sometimes it's purple. Sometimes it's oval. There are small migrating hairs that are the size of a coin and are also signs of disease. You're not too wet, are you? I'm sorry. And this is to show you, you see, when they say that I'm talking nonsense, these are published studies. 16% of patients remember the tick bite, and in children it's 19%. For instance, ticks like to bite around the navel, a place where they can hide as it's warm and safe. They tend to remain hidden, and this circular ring you often notice is a typical sign of a tick bite. This patient, for example, had Lyme disease. he went to see a renowned internist dermatologist in Paris who told him that he had performed a biopsy. You should never perform a biopsy. A biopsy is a small sample taken to send to the laboratory. If you do a biopsy like that of a migrating erythema, under the microscope it looks like skin cancer. There are other diseases that can mimic skin cancers, and so it was sent for chemotherapy for skin cancer, and then it relapsed years later. But these are not jokes, these are things we unfortunately see. So, above all, do not do a biopsy and ask your doctor to give you 15 days of antibiotics in these cases. It's behind the ear there, it's a bit swollen, which is not typical. If you see your medical professional, he will actually tell you that the disease of the soul does not exist. It's nonsense, in fact. We are going to do a serological test. We will take a blood sample to confirm that you have the diagnosis. Above all, do not do this because, and this is in all official recommendations, I'm not making this up, if you conduct antibody testing at this very early stage of contamination, in 80% of cases there are no antibodies, they haven't had time to appear. So in the recommendations, a general practitioner must, I repeat, must, if they don't want to be sued, be attacked before the medical board for malpractice, is required to give an antibiotic treatment, generally for 2 weeks, to treat this infection because there are no other diagnoses when you have this centrifugal erythema. Unfortunately, many doctors refuse, saying even if I give antibiotics, I get reprimanded by the health insurance. Let's do a serology first. And you see, I told you it's negative, and the poor people who are not treated, the erythema sometimes ends up disappearing. It needs to come back from time to time, and they will later develop neurological diseases and many problems. And the doctor will say, oh, but that has nothing to do with it. It's not your tick bite from 2 years ago. So if you come across someone in the Jura forest or on the Paris metro with a red bump on the tip of their ear, hello, sir, hello, madam, you have Lyme disease. That's typical. There are no other possible diagnoses. It's called Borrelia lymphocytoma. It can be on the ear. It can also be on the nipple and the scrotum. I admit when you meet someone it's harder to see, but it's the same, especially do not biopsy. If you biopsy, very often it's indeed diagnosed as malignant lymphoma. I have seen people with amputated ears undergoing chemotherapy when it can be cured with 2 weeks of doxycycline, a common antibiotic. And that's if you also come across people who have this parchment-like skin where you can see veins through it. When I show this to general practitioners, they tell me, but I see this every day in my consultations. Yes, it is indeed an absolutely characteristic picture that can only be Lyme disease, very characteristic. They say it's just ordinary elderly people. Yes, indeed, but elderly people often, in fact, actually have this disease. It is called the great imitator. This term was used in the 19th century at the beginning of the 20th century for syphilis. Syphilis, Treponema pallidum, syphilis bacterium, is sexually transmitted. It's not ethical. It's the same spiral-shaped bacterium that can move quite quickly with flagella. Doctors at the time, they talked about the primary, secondary, and tertiary phases. Primary for syphilis is the syphilitic chancre on the tip of the penis or on the female genital organs. Then the secondary stage is a few days, a few weeks later. Then the tertiary stage where all chronic diseases and syphilis set in. Fortunately, she is healing. I'm sorry about the rain, but still, this syphilis could. In the past, there was no penicillin, so people did not recover. They developed terrible chronic forms, became paralyzed with joint and skin problems, and went mad. But it mimicked all the diseases on the planet, which is why it was called syphilis, the great imitator. So what does Lyme disease cause? It will cause extremely debilitating fatigue and severe migratory pain, such as joint pain, as well as muscle pain. If I go on the subway and ask who is tired, who has knee pain and all that, half the carriage will definitely raise their hand, so it's not very specific. And then, when we say it's psychosomatic, the doctor observes anomalies. It can affect all organs, skin, neurological, ophthalmological, psychiatric, articular, muscular, bone, cardiac. There are many autoimmune diseases, such as lupus, rheumatoid arthritis. I'm not saying that all lupus cases are Lyme disease, but be careful, it can present exactly the same symptoms. And then there are people who say, when I started my lupus, multiple sclerosis, I had been bitten by ticks before, I had the migrant's air, my doctor didn't want to believe it. Now I am paralyzed. And me, in my personal and honest opinion, when there is uncertainty, I treat and then see what happens. Not just me, there are many other doctors around the world who have treated Lyme disease, and we have been able to cure this kind of autoimmune disease with antibiotics. So, the problem is that when we say it's Lyme disease, we are actually referring to a complex condition that requires a deeper understanding. I'm sorry, it's a blow. The sun looks a bit blue over there. I don't know which way the wind is blowing, but I hope for your sake. Someone who has been bitten by ticks or without being bitten, we all carry bacteria that lie dormant within us. For example, in the past, tuberculosis. There were people who developed pulmonary tuberculosis with cavities in their lungs, sometimes coughing up their lungs until they died. And then other people who were carriers of the bacillus or tuberculosis all their lives but were not sick. It attenuates. That's very true. And who never developed the disease. Just because one is a carrier of a disease doesn't mean they will develop that disease. Being a carrier of a microbe doesn't necessarily mean it will manifest. It depends on the individual's condition, how they defend themselves, etc. That's why I call them crypto-infections, meaning unapparent infections. This concept was introduced, though not under this name, by Charles Nicolle, who was a Nobel Prize winner in medicine and the director of the Pasteur Institute in Tunis a long time ago. He won the Nobel Prize in the 1920s and wrote a remarkable book that is not easily found. I found it because approximately 30 years ago the Pasteur Institute republished it. He called it Inapparent Infections. His book is truly remarkable. It's truly a visionary book. It said that we host many microbes that we cannot identify and diagnose, which are responsible for many inflammatory, degenerative, and autoimmune diseases. When I say responsible, the microbe isn't the only one. There's the terrain, diet, and many other factors. The doctor will say Lyme disease, well, it's nothing, it's benign, it heals easily, actually. Yes, there are many mild forms, I acknowledge, even people who have never been treated and heal on their own, others who received 8 days of antibiotics and heal, yes, okay. But unfortunately, there are many severe forms, people who end up disabled, paralyzed. Fortunately, there aren't many rapidly fatal forms, there are a few. If you remember, as you may recall, there was an English rugby player who had a very extremely severe cardiac event and unfortunately died quickly. There have been very severe encephalitis cases, but usually it's more like a slow death. It gradually destroys the nervous, articular, and neurological systems. People become depressed, and it is a very common cause of suicide. There have been studies showing that many suicides were linked to the soul. And now there are many publications because we should not focus on the Borrelia of the soul. Publications in the world's leading medical journals show that depressed people who commit suicide are carriers of Bartonella, another group of bacteria. The more well-known one is cat scratch disease, Bartonella henselae. There is also Bartonella trench fever, which decimated Napoleon's army during the Russian campaign. Bartonella now, it is scientifically proven that it is correlated with many psychiatric diseases and also with malignant melanomas. Melanomas are a bacterial disease like many malignant diseases, but oncologists sometimes don't want to listen. 16 seconds before it cuts off. Attention, please note that you have it in approximately 13 seconds, right? It's going to blow up in 9 seconds. Hello? Furthermore, these Borrelia and other similar cryptic infections are difficult to definitively prove and confirm their presence because they did it on purpose. Initially, until the 1950s, one could freely publish on all these diseases transmitted by ticks or others. There was no censorship. We will talk about it later when the military stories come up. We no longer have the right to publish or speak freely about all these topics in scientific journals. That's why we deliberately and carefully made sure there are no good diagnostic tests. That's why we all have a huge and significant problem with both diagnosing and managing patients. Often patients are told they have chronic fatigue, fibromyalgia. For those who don't know, fibromyalgia is a syndrome where you feel tired and have pain all over. The doctor wants to get rid of you because he can't fit you into the category of a known disease. He tells you you have fibromyalgia as if it's a trash can diagnosis. They give you painkillers if you're not happy, antidepressants. And if you're really not happy, they hospitalize you in psychiatry. I'm summarizing. Be aware that there are hundreds of thousands. There are a lot of people, many individuals suffering from fibromyalgia in France. It's not necessarily just Lyme disease, but for many it's crypto-infections. Autoimmune diseases, I've mentioned, degenerative. There is scientific evidence that in many brains of people with Alzheimer's, there are many bacteria in the brain. There is Lyme disease, it's not just them. There are Treponema pallidum, syphilis bacterium. These Treponema pallidum are the agent of syphilis. There are non-syphilitic treponemes, which are bacteria such as opportunistic bacteria, normal bacteria of dental plaque. There's a proven epidemiologic link between rotten teeth and Alzheimer's. In Alzheimer's, there's an infectious part. There may not be only that. And then all the unexplained syndromes, neuralgia, meningitis, encephalitis, paralysis, depression. In fact, you can find the entire medical spectrum in this type of disease. That's why I don't blame the doctors, because since they haven't been properly trained, they are lost and say that it's not possible for it to cause all that. So in fact, it is indeed rapidly expanding. It is very present on all continents currently. It's called Lyme because it came out of the American laboratory near Lyme, but it has existed for a very long time. There are many borrelioses that are not these military bacteria that were already in Europe for a long time. But there are many natural Borrelia infections that cause very diverse and varied diseases. But due to the military omerta, it has not been studied. So there are very few reliable publications on this entire field. On other germs, you have approximately 1,000 publications each year, but here, there is not much. So it has multiplied by huge numbers. All states are affected. I remember not so long ago, the French Public Health Institute said there are only cases in Alsace. So when there was a patient who complained about being bitten in Brittany or Provence because they had been bitten by a tick and had an immediate interest, no, it's not true. There have never been any cases in Brittany or Provence. That's false. At the time, we didn't search in all regions. We only searched in Alsace, so it was only found in Alsace. In fact, it's everywhere. It's true that it was more common in Alsace. The most affected region is Creuse, Limousin, for other reasons. You see, it has exploded everywhere. And it had exploded in the United States. It was in 2011 because time flies. Before, in the United States, when you were a general practitioner, to declare a case of Lyme disease, you needed to have a positive serology. And the CDC in Atlanta, which is the Disease Surveillance Center, equivalent to Santé Publique France, but much larger in the United States, had accepted that doctors could report cases because they recognized that serology was not always reliable and that a general practitioner who saw a patient with all the compatible signs and had ruled out all other diagnoses, who had conducted a trial antibiotic treatment similar to what is done for tuberculosis. Not all tuberculosis cases in France are proven by culture, often a clinical or radiological diagnosis. We administer a treatment, we see if it works. And if it works, the doctor in the United States declares Lyme disease as probable Lyme disease. When they accepted this difference in the United States, cases went from 30,000 per year to 300,000 per year. Now, I believe they are at 400, 500,000, so it's clear that it is increasing enormously. So why are there ticks everywhere? It might not be the only reason, but with the use of various pesticides, there are indeed a lot of animals. It's an article from the French Hunter from 2018. I'm not a hunter. I don't usually read the French Hunter, but it was just to show you Very serious people have shown that there is a disappearance of many animals, birds, reptiles, and amphibians in our countryside, probably due to the excess of pesticides. I know that I have a house with a large garden in the Paris region. I always put a little feeder for the birds in the winter. A few years ago I used to queue up to come and eat at the houses. Now if I see one during the day, I'm very happy. There used to be hedgehogs, but they have disappeared. I haven't seen any for several years. We need to be really aware. Frogs, toads, all of them are disappearing in many regions. All these animals are also predators that eat ticks. We were told that serology in medicine is when a blood test is done to look for the antibody you have produced to react to a microbe. For those who don't know, there are several types of serology. ELISA is an enzymatic test, but it is not very reliable. There is the Western blot, a more reliable test. In France, you cannot perform the Western blot if the ELISA is negative. It's really scientific. Normally, it was even recognized by the Union, the Public Health Council, and later by the other health authority, that since the tests were not reliable, doctors could administer an empirical treatment, a trial antibiotic treatment. What I was telling you, we don't have proof. We have eliminated. We treat, even if the test is negative, we need to see if it works. And by the way, I had achieved this. It was a major advancement at the health authority a few years ago. It is set in stone that it is authorized. But since I left, all the bodies now, all of that has been thrown away. And the European CDC issued a warning, made a report in 2016, warning against the very good serology results from India that were announced. Because they themselves said that the populations are very poorly defined, there are many biases, and the clinic, the doctor's experience, is very important. Finally, there were people who conducted meta-analyses, who analyzed everything that was published. Michael Cook, whom I know well in London, showed that the sensitivity was not at all the 95% announced by the reference center in Strasbourg. Willy Burgdorfer, for those who don't know him, was a Swiss German who was the best specialist in Borrelia in the world after World War II. He went to Africa to diagnose African borreliosis caused by other tick bites. It wasn't Lyme disease, but its cousins. Burgdorfer was recruited after World War II by the Americans to manipulate Borrelia in the United States. And in 2007, you can find the film. I don't know if it's still on YouTube. Well, I found it not so long ago, Under Our Skin. Or if you search for an interview with Burgdorfer, you will find it. He speaks in English, but often you can find versions with French subtitles. And he is asked what he thinks about the 2006 recommendations of the American Society of Infectious Diseases, saying that Lyme disease is a very rare disease, that serology is perfect, and that treatments work very well in 15 days. He himself says it. You can see him speaking. It's a shameful affair. The reason is political. Money goes to those who produce the same thing repeatedly, which is nothing. It's Burgdorfer himself, Borrelia burgdorferi. He is the one who supposedly discovered the bacterium. In fact, he created it, but he had regrets at the end of his career. The Lyme disease serology technique needs to be completely overhauled by people who don't write the results before doing the research because they had decided it shouldn't exceed the 5% threshold. I have a French biologist colleague who wondered why they set the diagnostic bar at that level. So they look for the publication in a recently published major journal that cites a previous journal. That's how it works. Each journal cites the previous journal saying it's proof because it was published before. Then it goes all the way up. It reaches a recommendation from the CDC in Atlanta, United States, which states the threshold that was established according to scientific criteria in a reference laboratory. He wrote to the CDC in Atlanta, "It's been 10 years. Can you give me the name of the reference laboratory?" What did they base all this on, you know? There was never an answer at all. Anyway, it really came out of nowhere. They imposed these useless diagnostic tests on all the countries in the world, on all the doctors in the world. Moreover, as I was telling you, when we are bitten by ticks or even through other means, such as airborne, sexual, foodborne, or respiratory routes, we can be contaminated by other crypto-infections, these inapparent infections, some of which are very well known to veterinarians. So we discovered, for example, we published that Borrelia miyamotoi, it's a Japanese name because it was discovered in rodents in Japan a long time ago, Strasbourg told me, but no, there aren't any in France, that's Japanese nonsense. We published that we found it in the east of France. There are many other bacteria. I talked about Bartonella. There are also parasites, the pyroplasms. If you have a dog, a cat, a horse in the countryside, your vet will tell you, but it has pyro, the horse loses its hair, it urinates red, or the dog that's known to vets, it's common in humans, and in humans, we are not allowed to diagnose it. In official medicine, pyroplasm only causes very severe forms in immunocompromised individuals or those who have lost their spleen in an accident. But it doesn't exist because, in fact, we don't look for it, and the serological test is very poor. In reality, when we do proper analyses, it is very common in humans. And Theileria, it's a small parasite at the bottom that is part of the pyroplasms transmitted by ticks. One day, I was working in research with a veterinary laboratory in Lyon, who was authorized to conduct tests with me on humans. We published all that, and I had read a publication from a team at INSERM in Paris, which showed that Theileria, a parasite transmitted by ticks, if placed on human cells in the laboratory, they became cancerous, and if Theileria was removed, the cancer disappeared. I'm not saying that Theileria is the agent of all cancers, rest assured. I was talking about this with the head of the laboratory, and he told me, it's funny what you're telling me because the other day I made a mistake. There was a patient who came to do a test as a human patient, and he told me he made a mistake. He gave her the horse kit, and she tested positive for Theileria. So I thought it would be interesting to investigate because it had never been done before. And then, bingo, Theileria is one of the most common crypto-infections in humans. We published it, but even if we publish, no one reads our publications anyway. Since antibodies are not reliable, it would be interesting to identify these germs using the famous PCR, which you became familiar with during COVID. PCR is a good test when done by skilled hands and under proper scientific conditions. For these diseases, it still lacks sensitivity. And what was incredible is that we achieved very high-performing results in veterinary labs. Who had the worst troubles because the patients are not fools. Some of them saw that other patients had been diagnosed in several cities in France by the veterinarian, so the friendly veterinarian would say, it's Perronne's cow or Homburger's dog, and it would go like that, but they were reported, they were threatened, so now almost no veterinary lab accepts to do it anymore, whereas about 10 years ago they did it regularly. This is to show publications of which I am a co-author. We found many germs that were really under research. It was an official research work that was accepted by the authorities. We found many microbes in people who had syndromes that resembled Lyme disease. Since there are no reliable diagnostic tests, the doctor says, it's all in your head and sends everyone to psychiatry, that's easy. For adults, it's already hard. And for children, when a child who was very bright suddenly becomes grumpy, has pain everywhere, doesn't want to go to school anymore, sleeps all the time, is depressed. In depression, there are two types of depression, and the person who is in great shape, happy in their job, in their family, who goes on vacation in the Jura right here, goes for a walk, then comes back a few weeks later, and suddenly they are depressed. I don't know why. So this is infectious organic depression where Borrelia and perhaps other microbes reach the brain. And it can be treated entirely. If it's mild meningitis, it's viral meningitis, it will pass on its own. And this is an organic cause that can be treated but is never diagnosed. And then there is the other, more frequent depression, which is that these poor patients who have been wandering from doctor to doctor for years are told it's all in their head, that they are crazy. They end up really depressed, wanting to commit suicide due to rejection by the healthcare system and their own family, because the doctor tells the spouse, your wife, your husband is a crazy person who wants to take advantage of the system or who is abusing everyone. So, the psychotic troops, Munchausen syndrome. I have known real Munchausen cases. I think I have known 10 in my entire career. Munchausen are people who destroy themselves, who mutilate themselves voluntarily, even by inoculating very nasty microbes. It's exceptional. Now everything goes. Maybe nobody is well. It's a Munchausen, and Munchausen by proxy accuses parents of inoculating filth into their children, and that's common. You shouldn't believe that it's... And all the judges are fully on board with it. It's horrible. So ultimately, chronic patients are not treated. You saw it recently. You learned this word randomized, which means random selection, either against a placebo or against a reference treatment. Everything has to be randomized, otherwise it doesn't exist. There was a randomized study like this for the treatment of Lyme disease in the New England Journal of Medicine, the largest journal in the world, conducted by an American military doctor 20 years ago, which ultimately says that 3 weeks of antibiotics against a placebo does not work in chronic forms. It's 3 weeks. That's ridiculous because chronic Lyme disease can require 3 months, 6 months, sometimes a year of antibiotic treatment and more, including hydroxychloroquine and all that. If I were to conduct a randomized study today to say, hey, I have a new anti-tuberculosis drug, I'm going to evaluate it over 3 weeks. Tuberculosis treatment is 6 months to a year. It wouldn't work. So you see that the way the protocol was actually designed was made so that it shows nothing. And now my colleagues say, no, now you stop your nonsense with the treatment of Lyme disease. It's been proven for a long time that it doesn't work. For years, when I was still actively involved, I had requested and written protocols to evaluate prolonged antibiotic treatments in the field, and they were always refused. It has already been demonstrated that it didn't work, even though it was not the same protocol. We are not treating an imaginary disease. That was the level of the experts who were making the critique. There is never a single cent for Lyme disease. For AIDS, there are millions. For other diseases, there is plenty of money, but for Lyme, zero. There is a need to evaluate all this because it's true that here there are surely many doctors who have treated many patients, and I thank them because they are not numerous in France. They have been called charlatans because they used antibiotics, antiparasitics, antifungals, anti-leprosy drugs, and even phytotherapy, which works very well in some cases. People say all of this has not been evaluated, it's not proven, so it's nonsense, yet it has saved millions of patients around the world. I didn't learn about plants in medical school. I learned that from my patients because I might be one of the few. A doctor who always listened to my patients. I saw long-suffering patients who were not well, and then I saw them much better. At first, they didn't dare talk to me about it, since you don't tell professors that you've been taking plants in secret. I didn't care. Later, they saw that I was nice, that I listened, but they taught me a lot. It is thanks to the patients that I have learned about this field that many may practice today. And now I am quite good at phytotherapy. I have been practicing it for years. So those were the first published examples, but then you see Dr. Zhang, whom I met, a Chinese doctor who worked at Johns Hopkins University in Baltimore, a brilliant guy who conducted many studies and showed that all these plants, and this is not an exhaustive list because there are others, work on Borrelia, but there are many, many plants that work on a lot of bacteria. All of this is demonstrated, but they keep telling you that Lyme disease doesn't exist. It's in your head. I'm not going to list all the references, but I can give them to you if you want. There are plenty of scientific references that say, of course, the symptoms of the disease can persist after a few weeks of antibiotics, that even in animals and humans, the bacterium can be found in culture or PCR, despite a treatment that, according to the authorities, has cured everything, sterilized everything. That's total nonsense. 14 scientific references, you put them under the experts' noses and you say, no, it's nonsense. I can't believe it. I'm a scientist. I can't stand it anymore. All this because they are manipulated. Some are corrupt under the influence of lobbies. When I talk about the bacterium, there was that famous debate between Deschamps and Pasteur, but for me it was nonsense. Even Pasteur acknowledged that the environment was important, and Deschamps was wrong when he said that the bacterium had no role. There are both the external environmental microbe and the terrain, but I'm definitely absolutely fully into this, I agree. Because in my experience, if I treat the bacterium with antibiotics, quite a few people will get better, but sometimes they will relapse, and others will not get better at all. They will improve a little, then relapse. And then I realized I actually discovered it while pedaling like that. I hadn't been trained that way. In the field of natural medicine, you definitely saw this well before I did. There are genetic factors, of course, but there is also stress. I have cured people of Lyme disease and then a major stress, like losing their spouse in a car accident, and 15 days later they relapse completely. Psychological trauma, domestic violence, sexual violence in childhood, nutrition plays a fundamental role, and I agree with nutrition specialists that refined sugar is a poison, I think, for many people, for both inflammatory diseases, chronic diseases, cancer. There are quite a few things. When we see that the major cola manufacturers sponsor the Olympic Games and then also physical activity, what I was saying is that people who get better and then suddenly relapse, so there is stress. And also, what struck me, I had seen it quite a few times. People are cured, they are not doing too badly, and then they get an acute infectious disease. So it could be infectious mononucleosis, it could be cytomegalovirus, malaria, they've traveled, dengue, chikungunya, and now COVID, and poof, all their chronic illness comes back in full force afterwards. Because for me, these acute diseases temporarily demolish the immune system and then allow other germs that were quietly dormant, which were more or less controlled in a normal situation, to wake up. There is a whole controversy about long COVID currently, which is obviously much more common in people who have not been treated with charlatan treatments, hydroxychloroquine, ivermectin, vitamin D, so it's absolutely proven that it works. When I still hear people, experts, journalists saying that it doesn't work, I feel like strangling them. It's absolutely published. There are even ministers in other countries who apologize. It's true that there are cases of COVID. We'll talk about it later with COVID, where the virus persists for a long time. The virus has been found a few times several months later, but it's rare. In my opinion, it's more often the reactivation of dormant infections. Sorry for you. So when I was president of commissions at the Haute Autorité de Santé, I had achieved many advancements. Rest assured, they have all been thrown away since I left. The insufficient quality of the tests was acknowledged. But now, if you ask the Ministry of Health, the serology is perfect. The OSPPT, we had obtained this definition, persistent polymorphic syndrome after a possible tick bite. It's very complicated, but it allowed a doctor, even a general practitioner, to say, well, I've ruled out a common known disease. I'm not quite sure what it is personally. Possibly a tick bite. I have a somewhat unexplained syndrome. He had the right to include it in this framework, called SPPT. The response to a trial antibiotic treatment as a diagnostic method was noted by the authorities, by the High Health Authority. I have a doubt I do an antibiotic treatment. If the patient is delighted after a few weeks saying, I feel much better, that's the proof. It is necessary to adjust when treating these chronic infections 3 out of 4 times. In old severe forms, patients get worse before improving. So I always warned my patients, the treatment could knock you out. You might feel terrible for a few days, a few weeks, or it might be a roller coaster. But if it gets worse, keep your spirits up. It's a good sign. It means it's working because it releases the toxins. And then there was the possibility of treating for extended periods under the supervision of the authorities with data recording for research purposes. The principle had been accepted. We don't know if these prolonged treatments work or not, but we are going to create registries in the reference centers that were supposed to be established, and see if the people who receive these prolonged treatments will actually get better or not. And there I can tell you that these reference centers that have been created are a disaster because there are some all over France. They were entrusted, so I had the highest number of Lyme disease patients in France. I wasn't given a center because I was deemed incompetent, and they entrusted the centers to infectious disease specialists who are staunchly anti-chronic Lyme. And now I receive absolutely horrible testimonies every day where patients are being thrown out like dirty rags. Your negative tests will circulate. You don't have the spirit. They send you to psychiatry. They give you antidepressants. It's horrible. A glimmer of hope is the CDC in Atlanta, the Centers for Disease Control and Prevention in the United States in 2023. It's the first time he's written it because for me at the HHS, at the Health Authority, if I said that Lyme disease could be chronic, I would be shot on the spot. It was tolerated to say persistent, but the word chronic was forbidden by decree. And then the CDC in Atlanta, which had been the largest disinformation agency on Lyme disease for several decades, admitted that Lyme disease could cause chronic disorders. It's indeed huge. It may not seem like much, but it was last September or October. To conclude on prevention, because it's always better to prevent than to cure, there are vaccines available in general in the first place. The limericks made by GSK over 10 years ago, 15 years, I don't remember when, was withdrawn very quickly because it triggered exacerbations. Since it was tested on adults, they did not have authorization for use in children. In the most affected regions of the United States, in the Northeast regions, many people who were injected with the vaccine were adults. They already had Borrelia in them, even if they were not all sick. And the inoculation of a high dosage of external antigens triggered inflammatory flare-ups that reproduced the symptoms of Lyme disease. Since there were 5,000 complaints in a very short time, they stopped immediately. This is not the case with the COVID vaccine. It has caused millions of deaths. We don't care. There were 5,000 complaints. They stopped. And now they are making new vaccines. The little novelty that might be better is that they include several species of Borrelia. But actually, I think it won't solve the problem. We will inoculate people who have already been carriers since childhood. It won't change anything. Don't get confused, because sometimes people tell me, but if there is a vaccine for Lyme disease, my doctor offered it to me. It's the tick-borne encephalitis vaccine, which has nothing to do with it. It's a virus. And in Europe, it's found in the forests of Central Europe. It reaches as far as Switzerland. There's a little bit in the Jura, in Alsace. There have been a few cases in Limousin, but there are practically none in France. It's a very different disease, and if you go camping in the forest in Bavaria or Vienna, I recommend the vaccine, but it has nothing to do with the donkey. It was a mayor in Lorraine who was very dedicated and had greatly raised awareness among the local population. I had asked the Ministry of Health a long time ago to train scouts, hikers, and outdoor sports enthusiasts at the entrances of forests about the risk of ticks. It's not to scare them, it's just to inform them so they take the right preventive measures. I was told that we should not alarm the population, and it was refused, whereas there are countries where there are signs at the entrance of forests to inform you. It was a mayor who was somewhat resistant. For prevention, if you go into the forest, if it's just to see the landscape, you can stay on the paths. It's much less risky than going into the ferns. But otherwise, there are chemical repellents that work very well. They are the same for ticks and mosquitoes, like insect screens. I mentioned the brand names not to advertise, but otherwise people don't know what it is, 5 out of 5. But now I prefer natural repellents. Notably, the eucalyptus lime blend that has been marketed under the name Citriodiol. Now you can find plenty of it on the internet. It has been validated by the Research Institute in Neuchâtel, which has really shown that it has a repellent effect. Also laurel at Pavorol. There are essential oils that seem to work. I had wanted to set up a randomized study with the Pronarum laboratory using their product Aroma Forest, which is taken in drops. Unfortunately, COVID arrived unexpectedly, and all of that fell through. Turmeric as well, unfortunately. After that, even the army has done it in some campaigns in nature. infiltrating, or foresters have done it, infiltrating their clothes, or even when you have your mosquito nets in Africa, you are told to soak the mosquito net in permethrin, which is a chemical product. Using it from time to time is probably harmless, but using it every day can be toxic in the long run. Even if you use DEET or chemical repellents once in a while to go to Africa, it's not a big deal. But if you use them every day, we know it's not recommended for pregnant women and children. So, of course, systematic inspection after possible exposure and quick removal of ticks is essential. It's better to avoid bothering them by putting something on them beforehand. You need to remove them with a tick remover, otherwise you might infect yourself. When you remove the tick, you shouldn't pull it out abruptly because it has small barbs like harpoons or swordfish, which are anti-reverse hooks. And if you pull abruptly, the rostrum, the part that is in the skin, breaks. So if it breaks, what I do is take a small needle like a splinter, remove it, and disinfect it. But often people leave the rostrum, and then it creates inflammatory lesions at the injection site that can last for months, even years. So it's better if you screw or unscrew in the direction you want. It doesn't matter if you turn while removing. The small anti-return hooks fold back, and you can remove it without any problem. This is to tell you about our friend Otzi, because he was named. It is this man, this hunter, who indeed, according to these young people of Corsican or Sardinian origin, was actually found deep in a glacier in the Alps, in Tyrol, at the border of Austria and Italy. Truly, they fought between the Italians and the Austrians, but I believe he was just a few meters on the Austrian side. He was extremely lucky. He had millions of euros to analyze his mummy, which the average French patient does not have, and we found that he was full of Borrelia. What is very amusing is to know that this man, more than 5,000 years ago, had therapeutic tattoos on his knees and joints, meaning that even back then, there were doctors who made tattoos to treat joint problems. So especially this I loved. He carried a small satchel with him, and guess what was in his satchel? Therapeutic mushrooms. I have a friend, a great specialist in mushrooms, who told me he had the best mushrooms to treat garlic in his bag. They knew things 5,300 years ago. For those who are interested, but it's more for healthcare professionals, I have been co-organizing a European conference on crypto-infections for several years. The next one will definitely take place in Compiègne in October. You can also follow it via video conference if you're interested. It will be quite highly technical and scientific in nature. It's not too targeted at the general public in general. There are mosquitoes here as well. I didn't put on my repellents before. I didn't know the Jura was so dangerous. After that, we'll move on to the other conference. I'll give you a short break.